from the Prime Minister at 5 o'clock. The headlines. The Oxford COVID vaccine is being rolled out to GP surgeries in England, and after warning that vaccine supplies were running low in Birmingham, an assurance.
And ultimately, that is the public health justification, and I think it's why there's so much buy-in to this approach.
And at 5 o'clock, more on the vaccine rollout from the Prime Minister, who will be joined by the CEO of the NHS, Simon Stevens, and Brigadier Phil Prosser. Is going to run out tomorrow, but the city's mayor says he's been assured that from tomorrow supplies of the AstraZeneca Oxford vaccine will start to be delivered.
Hospital are COVID patients, and that is obviously having a big impact on hospitals. It's pushing out the sort of non-COVID work they can do. We've heard a lot about routine treatments like hip and knee replacements that are having to be cancelled and postponed. But this week we're hearing how some urgent cancer care is also being cancelled. So this is having a dire effect on the NHS at the moment.
Let's go to Downing Street because we can see the Prime Minister has just arrived. Let's listen in.
Good afternoon. Today I'm joined by Sir Simon Stevens, Chief Executive of NHS England, and Brigadier Phil Prosser, who is Commander of Military Support to the vaccine delivery programme across our United Kingdom. Because how we're cracking this problem and how the national vaccine effort is progressing. And you rightly want to know how we're going to reach the target, including older care home residents and staff, everyone 70 or over, all frontline NHS and care staff, and all those who are clinically extremely vulnerable. And just to remind you of the importance of these groups for fighting the disease, they account for 88% of all those who have sadly lost their lives. And so our tactics.
And the health and care staff who look after them by the 15th of February. And as he says, if that offer is accepted, and we very much hope that when people are invited for vaccination, they will come forward to take in, and the distribution works well alongside the usual channels that hospitals and GPs and pharmacists provide. And it's that combination then of those three parts to the plan that are what are, we think, going to give us the opportunity to...
In NHS England headquarters. In my day job, I am Commander 101 Logistic Brigade. We'll defeat this pandemic together. Thank you.
Thank you very much, Brigadier, and thank you very much, Simon. At the moment, so in a sense, it depends on all of us following the guidance, protecting the NHS. That is the crucial thing. To look at some relaxations of restrictions, and as I've said, schools will certainly be the priority that we want to address. And to repeat, I do think that things will be. NHS from your doctor saying that you're eligible for a vaccine, please take it. Can we go to Emily Morgan of ITV? Can do, frankly, to support students and to help them in what has been a very, very difficult time. And
I've been immensely proud to see how everyone in this programme has stepped up to deliver professional excellence.
Press conference today is just to give you a chance and to give the public a chance to see a little bit more of the working, a little bit more of the detail. But that's just the beginning.
So that vaccine is being distributed today, tomorrow, the weekend to practices.
I think you heard eloquently now from the head of NHS England, the pressure the NHS is under.
And we're finding a very good response when people are invited to come forward that they will do so. On the first question, well, the answer is a very straightforward one, which is yes.